Hundreds of young people urgently needing a mental health bed are struggling to receive the care they need close to where they live. This video presents a summary of our research that looks at the experience of some young people who are admitted to hospital because of their mental health. Adolescence is a time when many young people struggle with their mental health. For those with severe mental health problems, if things become too complex or unsafe for them in their daily surroundings, the decision is made that an admission to a mental health unit is needed. However, the number of children and adolescent mental health beds is low and varies in location throughout the country. This means that many young people face being admitted to a mental health unit far away from their home or to an adult mental health ward. Little research has looked at these experiences, so our understanding of what is happening is limited. The Far Away From Home research study was carried out to understand and improve the experience of care for young people who required admission to an inpatient mental health service. In this animation, we summarise the results of this work. We interviewed 118 young people, parents and professionals working across inpatient and community teams, as well as service commissioners, to gain a better understanding of the impact of these admissions on people. Inpatient admissions far away from home or onto an adult ward can lead to additional distress and uncertainty for young people and their parents at what is already a difficult and traumatic time. Our findings showed that although they were informed about what was happening, young people and their families did not feel involved in the admission process and often struggled to find essential information about a unit. This included wanting to know what possessions their child could take with them or where they could park their car when visiting. For those young people admitted to an adult ward, families were unaware of what that ward would be like and how different it would be from an adolescent one. Concerns were raised about possible risks to the safety of a young person whilst on an adult mental health ward. Young people reported a lack of age-appropriate activities and educational provision during these admissions. They said they often felt lonely and isolated because of a lack of social interaction and bonding with others of a similar age. These admissions led to practical and financial issues for family members, including high travel costs, additional childcare challenges for siblings, and difficulties taking time off work. Young people also expressed difficulties keeping in touch with home because of limited access to mobile phones or video calling, and experienced further issues when being discharged or transferred closer to home because of a lack of confidence in their home environment as a result of being separated for long periods of time, difficulties accessing education, and a lack of communication between healthcare teams. Despite these issues, far away from home admissions can benefit some young people and parents by providing a space away from unhelpful social environments which can be an aid to their recovery. Some clinicians felt adult wards may be more socially or clinically appropriate for certain older adolescents who may live more independently than others. Our findings highlight the importance of providing easily accessible information online for young people and parents, so they feel they have the information they need prior to an admission. Issues caused by the large distances involved in the admissions highlight the need for better emotional and practical support for families. Better working relationships and information sharing between adult and children's mental health services could also help ensure young people receive age-appropriate care. More information about this study can be found on the ARC East Midlands website.